Hey guys, have you ever been one of those people that watches the St. Jude Radiothon on the news broadcast for the St. Jude Dream Home giveaway, or listen to the radiothons they have once a year for their fundraisers, or even listen to or watch the survival stories on St. Jude patients, on their survival stories and really don't pay much attention. Well, I mean, I was one of those people. I didn't like listening to it or watching the stories because it was just so sad, and it didn't directly affect me. So, I didn't pay much attention to it. Well, come to find out, our daughter, her name is Camille Davis, she was diagnosed with acute lymphoblastic leukemia at 8 months old, and we were quickly rushed to St. Jude, and she had pretty much from start to finish a 3-year treatment plan. So what I'm doing today is kind of discussing what is ALL, what kind of symptoms and the diagnosis, and the chemotherapy treatments. There's 3 main stages they do whenever you start the chemotherapy treatments, and I'm kind of informing you of how they administer that and how it goes. To start off, ALL is pretty much a cancer of the white blood cells. It's it's an abnormal count. The bad cells overrun the good cells, so it forms the disease of acute lymphoblastic leukemia. There's acute lymphoblastic leukemia, which acute means fast spreading. If it's not caught in time, it can cause death due to the overcrowding of the bad cells on top of the good cells. The final, like the symptoms, I guess, to be able to start trying to diagnose you with the acute lymphoblastic leukemia would be weakness and fatigue. They've got anemia, abnormal fevers and infections that come on all the time. The bruising, there's excessive bruising, enlarged lymph nodes, and bone and joint pain. That's just a few of them. There's a lot more different symptoms that you can have. Camille's actually started with a big bump on the top of her head. I mean, just really big bump. We thought she had fell and hit her head. She was only 8 months old. We took her in. They said just kind of watch it. Well, within a few months, there was a lot of bumps all over her head, behind her ear. I mean, they were just everywhere. So after 2 months of the doctors trying to, find out what this was, we finally were sent to St. Jude thinking it was lymphoma at first. And the final test they did to diagnose the leukemia was a bone marrow aspiration. And that's, if it's in the bone marrow, it's leukemia and not lymphoma. So she was diagnosed with acute lymphoblastic leukemia and immediately started treatments. Another test they do in the very beginning of your diagnosis is the lumbar puncture, which makes them see if it's spread to your spinal fluid and in your brain, which in Camille's case, it was everywhere. It was in her spinal fluid. She started treatments within, I think, 4 to 6 hours of being at St. Jude. The next thing I was going to talk about is the chemotherapy has 3 stages. They start out with the remission and induction stage. This actually starts off to kill all those cells that are in your system so that the patient can get to remission. They want the patient to have long-term effects where they stay in remission longer, because they don't want you to relapse within the first year, because you start over from the beginning. So that stage, is 6 or 7 drugs that they administer. Usually it's daily. There are some that's monthly or weekly, depending on the patient's progress. The number 2 stage is the consolidation and intensification. This is where you do the high-dose chemotherapy. This is also daily, monthly, weekly. It depends on the patient and what they actually have going on. It's also 6 or 7 drugs, and it's actually different drugs from the first to some are the same, but most of them are different in the second stage. And that stage kind of kills off for the long term. I mean, they want it to really kick in and get all the cells in there killed to where in the long term they won't come back. And the third stage is, this is the last and final stage, it's the maintenance therapy. This pretty much gets rid of all the residual cells that have stayed in that weren't killed throughout the remission and the induction stage. This usually is about 2 to 3, sometimes more drugs that they administer throughout this stage. And actually, it kind of dies down to some of them you only go in weekly. You know, there might be a daily oral dose of certain medicines, but mostly it was weekly. I think when we started her maintenance therapy, it was every Thursday we went in for an all-day chemotherapy, and then at home we gave certain drugs daily that needed to be for the maintenance therapy stage. On hers, she had a few different mishaps. She ended up having heart problems in her 3rd year. We were only 6 months till the end of her chemotherapy, and she ended up having fluid build up in her heart. Well, they thought they could just drain the fluid and kind of go from there. Well, come to find out, some of her heart was not working. So she ended up in 2010. She had open heart surgery, and they had to remove the lower left ventricle, some of it that was not pumping at all. And ever since her heart surgery, she's been healthy as could be. And she has stayed in remission since the very beginning. She was diagnosed February of 2008, and she was in remission by April of 2008. And she is how old?
6.
She just turned 6 years old, and she has stayed in remission and as healthy as can be. And we only go back to St. Jude once a year, right before or after Christmas usually. And they check all of her, you know, her blood count, her all of her cells, and they kind of keep up with it from there. Her heart is doing very well. She, you know, does have maintenance on that. She was on high, you know, the blood pressure medicine for a long time. They just took her off of that this past year, and they're just going to kind of keep up with, you know, checking her once a year for any heart problems that she might have arise or anything like that. But they think all of that will be way, way down the road before anything has to be done. But they've kept her in remission. So in conclusion, pretty much just pay attention. The research this kind of gives you an idea of what ALL is. There's lots of childhood cancers that they treat there at St. Jude, but this kind of gives you an insight of what ALL is and what they do, the process. And here she is, 6 years old, and she had to, everything I explained, she had to go through. Some of it was a little bit worse. She had to go through a little bit more than some patients. And some patients, you know, I mean, do not survive. The survival rates went from 4% up to 94%. And she was diagnosed with the MLL also, which is a totally different mixed lineage leukemia. And her survival rate was 20%. And are you tired? And you see her right now, 6 years old, and as healthy as can be, and curly hair, just cute as can be. And we're happy to have her, and that's thanks to all what St. Jude does. They research and they keep making all these survival rates go up every year to where before long, you know, they'll have a cure for all of it. And so pretty much just hopefully this gave you kind of an insight of what this specific cancer is, even though there's a lot of them out there, and hope you kind of have a better understanding of it. Thank you. Tell them bye.
Bye.